Good afternoon, clinicians, spa owners, business owners, ladies and gentlemen. It's an honor and a pleasure for me to be up here talking to you. I'm delighted to be in Canada as an adult. The last time I was in Canada, I was a child, living with my parents in New York City. So of course, you can imagine, we would drive up to Buffalo, see the magnificent Niagara Falls, and then go across the bridge into Canada, which was a very exciting time for me to be going into a new country. But I haven't been back to Canada since. I'm happy to say that my adult memories that I'm forming right now are just as fun and exciting as my childhood memories were when I was a kid coming to Canada. So, I'm Dr. Setari. Please take my office phone number down, take my email address down. Don't think that you only have access to me today. I love educating. I love talking to colleagues. I really live and breathe my work. So feel free, call, text, email, anytime you wish. I'm at your disposal. Whatever questions you have, I'll be delighted to answer them for you. If you would like to follow me on Instagram or TikTok or YouTube, it's all Dr. Setari, Dr. Setari. I'd love to have you guys as subscribers or followers. I try to post videos fairly consistently, several times a week. Fun ones, educational ones. Again, do DM me so I know who you are so I can follow you back. I will give you a little bit of clinical and educational background on myself. I went to University of Pennsylvania for my university, my college, George Washington University Medical Center, for my medical school, and then Washington Hospital Center for my residency, which was actually in internal medicine. Yet, I am both a member of faculty and on the board of trustees of the California Academy of Cosmetic Surgery, and a member and on the faculty of the American Academy of Cosmetic Surgery. I've been in the field of cosmetics for a very long time. I've been in the field of body contouring since 2007. Ooh, my God, I'm dating myself. I promise you I'm not that old. But yes, 18 years I've been in the field of body contouring. Now, whenever I bring a device to my practice, I always want to make sure that this device satisfies these two very important criteria for me. And I suggest you follow my lead and make sure that these two criteria on any device that you're going to purchase from anyone, any company, satisfies these two parameters. Number one, safety. I want side effects that allow me to sleep at night. I don't want to have restless nights wondering if I harmed my patient. So I look for technologies that are very, very safe and have very, very tolerable side effects, which means they're minor. It's like bruising, inflammation, redness, and they're temporary. Or, you know, if they get something, it's like a tiny little freckle scar. It looks like a dot and nobody really notices it on normal skin. But that's not enough, because I don't want to line the patients out the door either, complaining about, oh my goodness, I gave you like $2,000, $8,000, $15,000, and I'm not seeing results. So my second very important criteria before I purchase any sort of technology for my office or bring any sort of technology to my office is efficacy. It's got to work. I have this little mantra for myself. If any technology is not good enough for me or my family, I'm not offering it to my patients. What kind of a doctor would I be if I wouldn't be willing to do something on myself, but I'm trying to offer it to patients? So if you are not willing to do that same procedure on yourself, if you needed that procedure, then that procedure should not be being offered to your patients. So anything that I bring to my office has to satisfy these criteria. Now, I gave you my educational background. You guys don't know me, so let me give you also a little personal background on who I am. I would never be on this stage talking to you right now about these technologies if I didn't absolutely, from the bottom of my heart, believe in these technologies. These technologies are revolutionary, and we're going to discuss the science behind them. We're going to discuss some of the logistics, the administrative sort of information behind them. But believe me, I love absolutely love my Quantum RF and my Morpheus 8, which is what I'm going to be talking to you about today. And I wouldn't be here discussing with you if it wasn't really deep down in my bones something that I absolutely believed in. Now, I remember reading probably about 3 or 4 weeks ago in one of these financial magazines, something really interesting, and it caught my attention, and I sort of memorized the phrase. And that's that in order to succeed, you want to think, what problems do people have? What issues, what concerns do they have? What are your patients' pain points? And then how can you solve those pain points? That's how you want to build your practice and your services. You want to think of what need is out there and how you can satisfy that need. Now, is there a demand for these services? Absolutely. The body contouring market, and I'm from the United States, from Los Angeles, so a lot of this, or most of this, is all US based, but I did do my research and I found from PR Wirepress Canada that these same numbers actually hold true for Canada. And what that is that body contouring, liposuction, I don't know, does this laser work? Let's see, where's that laser? Boom. Oh, it's not working. Well, you can see the top line, that's liposuction body contouring. It has been the #1 requested procedure year after year after year, going back a decade plus. And what I read about the Canadian market, at least for the last few years, 22, 23, and 24, body contouring has been the #1 requested procedure. So yeah, there's a huge market out there, and there's a huge demand and need out there for you with these services. By the way, I'm kind of pacing back and forth a lot because I know you guys all just ate lunch. I don't want you to go into a food coma. I'm trying to stay as entertaining as possible. My song and dance and juggling is not as good, so I'm kind of trying to keep you engaged and not falling asleep on me. So that's why I keep pacing back and forth. Okay, so surgery or no surgery? Well, most patients would prefer not to have surgery. If you were a patient, wouldn't that be your preference? And these technologies that I'm going to discuss with you, the reason they're revolutionary, the reason that they're game changers is because they are non-surgical. They can be performed by a doctor, a high-end plastic surgeon, like my good friend Dr.Setari I met last night. They can be done by nurse practitioners or physician's assistants. In fact, most of the clinicians that I'm training these days in California are not MDs or DOs. They are NPs and PAs. These procedures can be done in an exam room. Your patients do not need blood tests. They do not need a pre-anesthesia cocktail of Norco or Xanax, which means they can drive themselves to the office, drive themselves home. And there is zero downtime. With the Quantum RF, they are back in the gym the very next day, which is flabbergasting to think about. Lipo without lipo. You're going to reduce fat, you're going to tighten skin without having to cut or tear up any tissues. Ozempic and Mounjaro are huge in the United States. I know they're also huge here in Canada. Why is this important? Well, people are going to start losing a lot of weight. 5-10 pounds, not a big deal. But once you get to 25 pounds, 35 pounds, 50 pounds, 80 pounds, what becomes the big problem? Loose skin. So these technologies are not only going to address volume reduction, size reduction, fat reduction, but they also simultaneously address skin laxity. So this market is a growing market that you'll be able to address with these technologies. So who is the IgniteRF target market? They fall into 3 categories. First category, no fat, just loose skin. I actually present this to my patients as a, is this not working? Hello? No, I don't think this is working. Can you not hear me? I actually introduced this to my patients as a scarless neck lift, a scarless facelift, a scarless arm lift. Nobody really wants to do that brachioplasty with that horrible scar all across the arm. These technologies allow you to tighten that skin without having to cut. Second category, minimal fat with or without loose skin. As long as the patients aren't too big, Quantum RF will be able to melt the fat, reduce the volume in the area. Thank you very much. Hello? Is this any louder? Were you unable to hear me before? Oh, buzzing, I'm sorry. Should I take the mic off or it's off? Okay, good. So anyway, second category, minimal fat, either with or without loose skin. Again, this is the alternative that you're gonna be able to give your patients as opposed to full-on liposuction. Now, I'm sure you all have heard of cool sculpting, right? I hope I'm not gonna offend anyone here, but in my opinion, cool sculpting is junk. It doesn't work for the majority of patients, and that's not what I want. I want something that works for the majority of patients, not doesn't work for the majority of patients. And cool sculpting can cause PAH, paradoxical adipose hyperplasia. So where cool sculpting fails, Quantum RF succeeds. So think about that market of people who are going and wasting their time and money getting cool sculpting done. That's the market that eventually is going to be coming to Quantum RF. Mark my words, in 1 to 2 to 3 years, everyone is going to be talking about Quantum RF. And you want to be ahead of that wave. For the first time, this technology just got FDA approved last year and just got approved here in Canada. You are on the ground floor of these technologies. Third category, patients with significant fat, either with or without loose skin. This is mostly now for the doctors, for the surgeons who are actually doing liposuction. They can do liposuction and then use these technologies as adjuncts. This is actually what I've been doing my entire career in body contouring. I say this often in my lectures. Traditional liposuction is a dinosaur. It's 50 years old. Would you drive a car that's 50 years old? Would you wear clothes that are 50 years old? Stop offering your patients traditional liposuction. They don't want it. If you saw in one of the earlier slides I showed you, 80% of patients want better. They want combination therapies that address multiple issues. So traditional liposuction should be out the door. And I've never done, ever, in my entire career since I started with body contouring, traditional liposuction. I've always done my trademark procedure, which is called UltraSculpt, which is a very modified, evolved form of liposuction using energy devices. And the latest energy device now that I'm using is the Quantum RF. I'll do my lipo and then I'll use the Quantum RF to tighten that skin. So, Quantum comes in, let's go back to actually some basics on Quantum. These are proprietary technologies. They're clinically proven. It's bipolar radiofrequency. This is very, very important because unipolar radiofrequency is worthless. That energy is going to ground wherever it wants to ground. So you're not really getting high energies in the area that you want. When InMode came out with their body type, it was revolutionary because that bipolarity made sure that you were actually delivering heat and energy right exactly where you wanted it. And they have just kept evolving and modifying their technology until they got to the Morpheus 8 and now the Quantum RF. The other aspect of Quantum RF is that it's fractional. It's not continuous. It's pulses and pulses and pulses. So just like other fractional technologies, like fractional CO2, by leaving healthy tissue in between, it allows the patient to heal faster, to heal safer, and with less discomfort. Can we play this video, please? 1 to 2 inches within a week, natural looking, tight skin. It was incredible. In about a year or so, this is all you're going to hear about. He sounds like he knows what he's talking about. I would listen to this guy. So as you can see, this is actually, I was on Dr. Angela Williamson's show on KLCS TV, and it was one of the first introductions of these technologies on television, and she was so excited. She goes, oh great, I'm the first one to be discussing it. But, you know, if I sound like I'm echoing myself, it's because this is exactly what these technologies are. They are unbelievable, and you're able to melt fat and tighten skin in one fell swoop. So quantum RF, let's talk about the mechanism of action and the science behind it. The bipolarity, as you can see, is right here, keeping the energy focused right where you want it. The rest of the cannula is clean. No heat, so therefore no collateral damage to other tissues. It forms essentially a halo of hot plasma right around the tip. And that's what's melting your fat and tightening your skin. Can we play this video, please? Seeing is believing. Pay attention, look at that contraction. Look at those edges. Look at that contraction in real time. And that's immediate, but that's not the end. That's the tip of the iceberg. Your patients are gonna continue to improve into 1 week, 1 month, 2 months, 4 to 6 months before they finally plateau. When I've treated arms, patients have come back a week later, they're reduced about a ½ an inch to an inch. I see them a month later for their next follow-up, it's 1.5 inches to 2 inches. It just keeps going and going and going. So the key thing here is the fibroseptal network. This is what's helping to tighten your skin. You're using the quantum to melt all of this fat, and then you have all of these FSN fibers here, and when you heat them up, those fibers contract. And when they contract, your skin is contracting in 3 dimensions, lengthwise, widthwise, and down. You can either do a single pass, or if there's enough fat, you can do multiple passes. The muscle and all the organs underneath are completely preserved. No, this is why it's so safe. You're only in the fat layer where there are no major organs to worry about. And this is just an example of some of the shrinkage that you can see. Again, paying attention to that FSN, that fibroseptal network. When you do these procedures, you come from a single adit, a single access port, in a fan-like pattern, making sure to cover the entire area. This is what helps give you a nice, smooth, consistent result without lumpy bumpies, without irregularities. Oh, can we play this video, please? And you're going to see just how easy it is. Hello everyone, this is Dr.Setari. We're going to be doing a quantum RF on my patient on her neck. She's got a little bit of fat that we're going to melt, and we're going to tighten her skin all in one fell swoop. If you look over here, basically, we're going to be going line by line by line. Like this, like this, like this. This is how we're going to be doing each single one of these lines. As you can see, there's this tiny, tiny, tiny little access port here. Formed with an 18-gauge needle. I don't even use a scalpel. I use an 18-gauge needle to create that adit. It's healed by the next day, 0 scarring. Pay attention to the volume on her neck. You'll see it shrink right before your eyes. And that was our first pass. We're going to go ahead and do a second pass. Same line. You can hear the crackles, and I can actually feel the fat melt beneath my fingers, and you can actually see it flattening out. Now we're going to go to our next line. I can actually feel the fat become this mushy soup between my fingers in real time. Unfortunately, I don't think it's loud enough, but there are crackles in there, and that's essentially the fat being destroyed. It's like snap, crackle, pop. And that was our 2 lines there. How are you doing, dear? Any pain? And that's our quantum RF. Patient's completely comfortable, just local anesthesia. No general anesthesia, no tubes, no IV, no narcotic medications. After the procedure, I tell patients, if you are uncomfortable, take some Tylenol, take some ibuprofen. Nobody ever has. The reports that I'm getting from my patients is that their pain is 0 to 1, 2 out of 10. That's nothing. This is why they're back in the gym the very next day if they wish.
What anesthesia did you give?
Excuse me?
What anesthesia did you use?
I have my own special formula of tumescent anesthesia. It's a little bit modified from Klein's anesthesia formula, but basically it's a normal saline IV bag. Inside of it, I'll put lidocaine, a little bit of epinephrine, a little bit of bicarb. I'm going to give you my little Setari secret. I also put just a kiss of dexamethasone. Nobody else does this, but I do. And it makes a huge difference in the patient's recovery. Just a little bit. Inside of a 1 liter bag, it would be just a milligram. Inside of a ½ liter bag, it would be ½ milligram. It's just a little dab of dexamethasone, but it makes a very big difference. That's my formula. Keep it to yourself. So, what are the benefits of quantum? Fast, efficient, short treatment times, safety, efficacious, minimal downtimes, single session. My patients are shocked because they're used to cool sculpting, that garbage technology, coming in for 4, 5, 6 sessions and not seeing results. 1 session and they're done. 1. And delegable to NPs or PAs. And for you, Doc, because I know you do body tight, I used to do body tight since 2018. I love body tight. I don't do body tight anymore. Not since November. I got my quantum in October. I haven't bought a cannula since. Why? Great technology, body tight, don't get me wrong, I love it. But quantum is superior. Once you have quantum, you'll never go back. And no messy gel, like the body tight. So, before and afters. This is using the Quantum 10, the smaller wand. Look at these results. I mean, I couldn't imagine this type of improvement without having to cut prior to these energy devices, prior to this technology. This is unbelievable. I mean, normally, if this patient came into my office, I would say you need lipo and probably a brachoplasty. Right, Doc? But look at this. No ugly scar from axilla to elbow. Nothing. Not even a freckle scar. Now the Quantum 25, which is the longer cannula, is what you can use for arms, because you can go from the armpit all the way to the elbow and come back as you're treating the arm. I usually use the Quantum 25 for abdomen and arms. I use the Quantum 10 for everything else. The most popular common areas tend to be neck, jowls, arms, bra fat, and abdomen. And for men, chest. pseudogynecomastia, this technology is fantastic for that. Okay, moving on to Morpheus. Well, Morpheus has been around for a long time. A lot of patients already know about Morpheus. A lot of patients already love Morpheus. But as Chris pointed out, this is now Morpheus 2.0. Actually, Morpheus 8 2.0. And so it's not something that you're necessarily going to have to explain to your patients because it's not absolutely new technology. But it is far better than the previous iteration. Lots and lots of clinical studies out on using the Morpheus for body contouring, for acne scars, for hyperhidrosis. You know, I was used to using, you know, Botox for hyperhidrosis, very uncomfortable, lasts about 10 months. Jack Cooper, who is one of our reps in California, was the first one who told me that he had used the Morpheus 8 for his hyperhidrosis, and he didn't mind if I use his name, so this is not a HIPAA violation. He did it 2 years ago, and it's still working for him. So, Morpheus 8, bipolar radiofrequency. What are the issues that can be addressed with Morpheus 8? Fine lines and wrinkles, iridids, superficial fat, acne scarring, stretch marks, fantastic for stretch marks, hyperhidrosis, cellulite and dimpling, and you'll see some examples of that in the before and after pictures. These technologies are fantastic on their own. You can use quantum by itself, you can use Morpheus 8 by itself, or you can combine them for a great synergistic effect if that's what your patient needs. So Morpheus 8 Burst, the black handpiece for the face, Morpheus 8 Burst Deep, the blue handpiece for the body. Think of it as blue, B, body. Again, bipolar radiofrequency, and now with the new proprietary scale and burst, which we're going to talk about, you have an incredible versatility with this technology. A couple of people have come up to me and Chris and asked about parameters, and quite honestly, it's difficult to give you straight parameters because you can individually set this technology for every individual patient according to their individual needs. And there are a lot of settings. It's like flying a jet plane. You have to really understand this technology so that you can use it effectively and safely. The way it works again, microneedles, no heat here, only at the tip. So no collateral damage. At the tip, you're getting the ablation, the coagulation. There are multiple tips that you can use for various issues. Acne scarring, resurfacing. Prime for the under the eyes, Morpheus 8 for the rest of the face, and Morpheus Deep for the body, arms, bra fat, knees, whatever areas, buttocks with the dimpling, phenomenal results. I believe this is a video. Can we please play this? So you're delivering heat exactly at the depth you want. But what if you wanted multiple depths? Before, you had to adjust every time the depth you wanted and go back again over the same area. Now, with the burst, one pass, and you're getting multiple depths. Same exact energy at both depths, if that's how you want to set your machine. But now let's look at scale. Let's say you want more heat deeper, but less heat closer to the dermis epidermis. Can we go ahead and play this, please? Oh, was that not a video? I thought it was a video. There we go. Is this the same video? Oh no, okay, go back up please a little bit. Back up halfway maybe. There, okay, there we go. So with scale, what you can do is have the setting set for more heat at the deeper depth, and then reduce heat as you come up closer to the dermis and epidermis. So incredible versatility for treating your patients. So you've got different tips, you've got various depths that you can set, you've got various power settings that you can set. Again, just so many different parameters that you can play with to get just the right combination for the problem that your patient is seeking to correct. I think we discussed all this already. For the body, you can get up to 3 different depths, and for the face, up to 2 different depths. And this is for the body, as you can see, 3 different depths, all the same energy with the burst, and varying energies. The highest energy, about 70% of this energy, and then about 70% of that energy as you go up. See the difference? Same energy there, less energy here. And because you can set multiple depths, the whole procedure is much faster than having to go back multiple times, 3 different times along the same area. And we have some great before and afters here. Look at that jawline. It's just gorgeous, gorgeous jawline. And her neck. Again, a nicely defined jawline from where she started. I could not imagine fixing this without having that cut. And then Morpheus 8 comes along and says, don't do surgery. I'm going to do this for your patient non-surgically in an exam room. Look at that dimpling and the results. I tell my patients they need 3 treatments or 3 sessions usually, but I'm telling you, after the first session 1 week out, my patients and I are both going, wow, because we're seeing the results that quickly, even with that first session. Thank you very much. Now, I unfortunately am not licensed here in Canada, so I can't do a live demo for you. But I did lecture in Santa Monica last month, in March, and I do have a quick video clip of that demonstration for you to observe. So if we can please play that clip. Today we're going to go ahead and do a demonstration of exactly what I talked about. The trifecta, the Setari lift. We're going to go ahead and do the quantum RF for our lovely patient Terry here under her neck. We're going to melt the fat, we're going to tighten the skin. Then we're going to do the Morpheus on her entire face for fine lines and iridids. And then we're going to do the CO2 for all sorts of environmental and solar damage to her epidermal skin layer. Pause for a second, please. Terrence, awake. So here I was actually demonstrating both the Quantum RF, the Morpheus 8, and Solaria, which is InMode's most recent technology they've come out with. You don't have to do the CO2. You can actually do the Morpheus 8 resurfacing instead of the CO2. Or if you've got the Optimus Max, your Lumecca IPL. Because what I like to do with my Setari lift is treat the heavier tissues with a Quantum RF. Then treat the more fine lines, wrinkles, and iridids with the Morpheus 8. Now you're taking care of everything that's deep, but what about the upholstery? What about the epidermis itself? Pollution and sun damage? That's what you would take care of with your Lumecca IPL. Now you've given that patient a non-surgical facelift from bottom all the way to the top without a single cut, with no surgery, a non-surgical facelift or a neck lift. Okay, let's play, please. And this is done on stage. Tumescent, local, anesthesia, topical, blocks. And if I can do this here up on the stage, you can do this in your office in any exam room. In my office, I've got an OR, but you don't need an OR. This is how simple and easy these procedures are to perform once you know the protocols and how to follow them appropriately. I personally am OCD, which is probably exactly what you want in your cosmetic doctor, someone who's a crazy fanatic perfectionist. And I'm a fiend when it comes to sterile field. So one thing I do want to emphasize that yes, these procedures are simple and easy to perform. Yes, you can do them in any good exam room or procedure room you have in your office. But you do want to follow appropriate protocol. Make sure you're maintaining proper sterile field for your patient, for yourself. I usually give 1 gram of Keflex to the patient the day of the procedure if I'm doing quantum, not for Morpheus 8 or for CO2, but for quantum. I'll give them 1 gram the day of the procedure and that's it. And again, this is like overkill. It's I'm a fanatic when it comes to being keeping infection under control, and so it's a bit of an overkill. But in nearly 10,000 cases in my practices across the board, we haven't had one single untoward incident. We haven't had an infection. We haven't had bleeding. Nothing in nearly 10,000 cases, and there's a reason for that. And it's because we're very, very cautious, we're very, very conservative, we love these technologies, we use them within the parameters they're supposed to be used, and we're cautious with, when we need to do blood tests, we do blood tests, when we need EKGs, we do our EKGs, when we need antibiotics, we use our antibiotics. So you want to practice the same level of care in your practice as well. So this is just pause, please. Anesthesia. It's just a half liter of normal. So when I'm doing liposuction with the quantum, that's when I'll do the blood test and the EKG and give them the Norco or the Xanax beforehand, and then they cannot drive themselves home. They have to get a ride. But when I'm doing just quantum by itself, I don't need or care about any of those things because it's not as traumatic as regular liposuction. It's about as atraumatic as anything can get to give you these same exact results. And as far as infection control is concerned, when I'm doing full-on lipo, I'll give them antibiotics to take home and to take for the next 5 days. But with quantum, just that day, and we're done. There's actually 4 levels of infection control with the quantum RF technology. Think about it. You're using a sterile technique. That's level 1. Your tumescent anesthesia is bacteriostatic. That's level number 2. The quantum gets to 120 degrees centigrade. No bacteria or viruses surviving that. That's level number 3. And then finally, Little OCD, I give them 1 gram of Keflex, just to be absolutely sure, and that's level number 4. Go ahead, please. And I put in my own personal mix or formula, which is 400 milligrams of lidocaine, an appropriate amount of epinephrine, bicarb, and my little secret sauce that I add to my medicine, which is just a little hint of dexamethasone, which I believe really helps my patients have less inflammation and a faster recovery. I'll leave that right there. The first thing I'm going to do is I'm just going to put in a few little blebs of anesthesia. The very first one is going to be submental, right here. It's a little bug bite. Is it okay here? Great. And then another little bug bite. So through these blebs is where I'll go in with a longer 22 gauge spinal needle and deliver the tumescent anesthesia. And those are just my access points for my actual tumescent anesthesia. The needle may look a bit frightening and imposing because of its length. It's actually very thin, very flexible. Any pain at all, Terry?
No, no pain.
Excellent. Now, she was enthusiastic about that. Isn't just acting as anesthesia for us. The fluid is also going to act as a bit of a heat sink, which will protect some of the surrounding tissues from any collateral thermal damage. Now, this is one way to administer the tumescent anesthesia, which is simple and easy and inexpensive, with a needle and syringe. In my office, I actually have an infiltration pump with tubing, and I just step on the pedal and the pump just goes, and it's like a garden hose just pouring out an anesthesia for me, and I'm able to anesthetize much faster with an infiltration pump. The choice is yours in terms of what you want to use in your office, whether you do it with a syringe and needle, or whether you go ahead and get yourself an infiltration pump. They're not that expensive. You can buy a good one, actually used and totally functional for probably about $2,000 or something. If you're going to be doing a lot of body work, especially like abdomen, I recommend the pump just because it'll speed up your cases. Yeah, neck is easy to do with a syringe and needle, but if you're going to do abdomen, I'd invest in a pump. It's a bigger area. You'll be there for 20 minutes just injecting. Efficient and adequate. How are you doing, Terry?
Good.
Excellent.
I'm here.
Now, as I said, there's a lot of versatility on these parameters and how you want to set your energy levels. The tip gets to 120 degrees centigrade. That's above boiling point. That's certainly enough to melt fat and tighten that FSN, that bioceptal network, and give us the contraction we need. The power setting that I'm going to set here determines the diameter of that solar corona that we saw on that slideshow that I showed you. Just how much that energy disperses. And because there is a circle of energy dispersal around the tip, you do not want you actually want each line to be its own line. There's really no overlap. You don't want to overlap because there's a bubble of energy around that tip, so you want to go to just right where the end of that solar bubble plasma was. No, it's like you don't have one treatment right next to a previous area you treat. You have to allow space for the spread of the energy. Generally speaking, half a centimeter or a centimeter between lines. Get the cannula in easily through that tiny little hole that I made. Any pain at all, Terry?
I'm good.
Excellent. Okay. All right. I just used an 18 gauge needle. That was it to create that addict. When I first saw her, how much loose skin she had, her age, and a couple of different factors. Let's go for 2 pp's. So that's 2 pulses per second. So with every press of the foot pedal, 2 pulses will go. And for energy, give me a 7. That should be good. Perfect. Okay, let's start with that. Overlap. You don't want any overlap of your treatment areas. So we're going to treat, as I showed in that other slide in the demonstration, this is going to be one of our lines. Then about a little half finger's breadth over, this will be the next line, and then the next line, and then the next line. And a half a finger's breadth is about a half centimeter. I personally don't like the energy to be activated when I'm going forward with the cannula. I like retrograde activation only because it's safer. If you're activating the energy as you're going forward, the tip could angle up and end up giving you a burn, so we don't want that. So the safest way is to go ahead and find your plane, cantilever a little bit down, and then activate all with a retrograde technique. Okay, here we go. She had done Kybella. She had some fibrosis I was trying to break up. Another junk technology, Kybella. That was already the first pass. How are you doing, Jenny?
Good.
Excellent. I'm going to do a second pass, same line. She has enough fat that I'm going to do 2 passes. She's very cute. Layers on the same line, like I showed you in the slide set. Okay, now we move on to our second line. I don't know if you guys can hear the crackles. I'll try to get closer here. Do you hear that? Jerry, you can hear it.
I hear them, yeah. Just go, yeah.
It's a nice sound to hear, isn't it?
Yeah. It's like little crunching.
Yes. It's kind of crackle pop.
Yeah.
That's the fat being lysed. And fibers being contracted with thermal energy. I'm feeling to see where my tip is, so I stop before I get to my adit, so I don't burn the skin. Oh, let's go to 8. Yeah. Correct. I was just thinking 7's conservative. Do you hear that? How are you doing, Jerry?
Good, I feel like it's just eating all the fat. It's crunching the fat.
It's melting the fat away. So she's adorable. Yeah, I don't know if you guys can actually hear the snap, crackle, pop. Terry and I can hear it. And it's just a constant crackle, crackle, crackle as the fat is being treated. It's amazing. And I can feel beneath my fingers with what we call the seeing hand. With your eyes in this seeing hand, you're supposed to be able to form a 3D image in your mind of what's going on underneath the skin. It's like an X-ray in your mind between what you're feeling and what you're seeing. And I can actually feel this fat melting down, becoming softer, so I can tell that I'm getting the results I'm looking for with my treatment. You okay, Jim?
Yeah, and the sound is calming. It feels, like you're walking on sand or something.
What I'm doing is also feeling where my tip is, because I don't want the tip activated when it's too close to my adit, to my portal of entry, because then I would get a burn. There we go. That's pretty much it. That's it. That's it. Her neck is treated. Done. Her neck is done. Yeah. Fast, quick, and easy. No suture, no steri strip, nothing. The camera can pick it up, but this is actually melted oil and I'm able to extrude. See that? Little oil droplets on top of that fluid? That's how much fat we melted. You see globules of oil on top of the tumescent anesthesia coming out. So to speak, a very nice improvement with reduction and tightening of this skin underneath her neck. Now, this procedure I just finished performing, and as you recall, I said that the Morpheus 8 and the CO2 are delegable to your RA. So now our lovely RA, Brittany, will come on stage, and she's going to go ahead and do Terry's Morpheus treatment and CO2 treatment while I go see my next consultation. So today I'm going to go ahead and do a demonstration. Okay, that's it. My point at the end was that these technologies are delegable. As a doctor, you can have your mid-level staff do a lot of these procedures for you under your guidance, so you can be doing other things while the patient is being treated. That's how safe, easy, and effective these technologies are. Well, I think that's a wrap for me for today. Thank you so much for your indulgence. I appreciate it. I hope I didn't put too many of you to sleep. Thank you. Please, I am at your service. I'm at your disposal. If you have questions, come up to me. I'm more than happy to answer whatever questions you have. Thank you.